Dr. Salah presented me, I am Associate Professor Dr. Lamia Wagdy Mohamed, Faculty of Pharmacy, Cairo University. Today I will be talking about design and synthesis of new 1,3,4-benzotriazepine 5-on derivatives and their biological evaluation as tubulin polymerase inhibition. First, I would like to focus on the tubulin polymerase inhibition. Tubulin polymerase is an enzyme which is responsible for the mitotic division of the cell. Of course, we're using here for an anti-cancer treatment, as an anti-cancer treatment, these compounds. So we're focusing about the inhibition of tubulin polymerase in cells. It prevents the regulated microtubule dynamics, which is spindle formation and chromosomal separation. We use this to treat cancer. As specific cancer treatment and targeting certain enzymes is usually associated with safe and effective anti-cancer drugs. So we have to treat this disease to improve the life of the patients. Here we're talking about angiogenesis, which is a step when it occurs, it aggravates cancer. So we have to stop it at this, where the red, sorry, I don't have a presenter. We have to stop it before angiogenesis and the progression of the cancer by preventing the mitotic division of the cancer cells. So we contain the cancer disease. Considerable amount of drugs have been produced for this. Here I'm focusing about the benzotriazepinones, which is a bioisosteres for the benzodiazepines. Benzodiazepine and benzodiazepinones have been long used as in many pharmacological aspects, but now they are focusing using them in cancer. Benzodiazepines has a unique structure. It mimics the peptide linkage, which shifted the interest of benzodiazepine from CNS acting drug to anti-cancer drugs. Many drugs with the base of benzodiazepine have been used as anti-cancer lately. Benzotriazepine as a bioisosteres for benzodiazepine have also been used. These are some drugs and some newly synthesized compounds used as anti-cancer with the ring benzodiazepine or benzotriazepine. This is devazepine. It's a colon cancer treatment. It's a benzodiazepine. Also asparlacine. It's a naturally occurring compound with benzodiazepine base ring. Also, this compound has been synthesized earlier in 2006 and was used for treatment of cancer. This compound also is a benzodiazepine dione and have been synthesized in the year 2001 for the treatment of cancer. Tubulin polymerases are characterized by having multi-methoxy and hydroxyl groups. So we're using some tubulin polymerases as isoindigotoone, congratestin, and phenystatin as drugs. This is isoindigotoone, congratestin, and phenystatin as drugs used as tubulin polymerase inhibitors and used for the cancer. We can see that they have methoxy and hydroxyl group as a linkage to the ring, to the main ring. Combining these two facts, that benzodiazepines and benzotriazepines are used in anti-cancer and the tubulin polymerases, the hydroxyl and the methoxy group, could use as anti-cancer, we combine these two factors for the design of our new compounds. Starting with isotopic anhydride, a compound available with aminoguanidine, we could synthesize a newly synthesized aminotriazepinone. It's a 2-aminotriazepinone. This compound further reacted with several aldehydes to give the Schiff's base. We have the Schiff's base, several aldehydes with the methoxy and hydroxyl groups with them. The first step of this scheme was utilized by the isotopic anhydride with aminoguanidine, the attack of the amino on the carbonyl group, and the release of carbon dioxide opened ring of the isotope anhydride with the amino as a side chain. Furthermore, by the usage of ammonia, the ring cyclized to give the benzotriazepine. This step was not previously reported. It's a new step. It's a new synthesis for the synthesis of benzotriazepine. The amino group was confirmed and the ring was confirmed by synthesizing the open structure, because we first thought that it might not cyclize. We were first questioning whether the reaction completed to the benzotriazepine or it stopped at the open structure. The open structure is so easy to be obtained. Even with the isotope anhydride and no other solvents on cold, isotope anhydride is highly unstable. With any nucleophile, it opens. The closing was to be investigated and to be sure it happened. So the open structure was separated, analyzed, and you know everything about its spectral data and physical character. Then the next step, with the usage of ammonia, the two compounds were compared, and we were sure that the reaction is completed, giving the aminotriazepinone. The reaction with the aminotriazepinone was several aldehydes, using aldehydes having the hydroxyl and the methoxy group, so that we could mimic the tubulin polymerases. Comparing several positions, starting with the para-hydroxy benzaldehyde and the 2,4-dihydroxy, to compare the added hydroxyl group would shift the reaction towards where. The 2-hydroxy and the 2-methoxy, to compare methoxy and hydroxy to each other. 3,4-dihydroxy and 3,4-dimethoxy. And the trihydroxy and the trimethoxy, where the isendigone, which was recently synthesized, to show whether the hydroxy and the methoxy, each of them, how do they impact on the structure. Further, the 3-hydroxy-4-methoxy, combining both groups in one structure. After usage of many hydroxy and methoxy groups, we turn to the amino, and the nitrogen could be replacing the oxygen group. The pyridyl, 3 and 4 pyridyls, and the 4 and dimethyl amino aldehydes were used. Several Schiff's bases were synthesized, then their cancer impact were being investigated. This is the receptor of the tubulin polymerase, with the drug number 6 being in the pocket of the enzyme, to show how the compound being in the pocket and how it's fitted to the enzyme. Here is the same compound, compound number 6, overlapped over colchicine, which is the ligand of the tubulin polymerase. From the protein data bank, we downloaded the enzyme or the protein tubulin polymerases. It's co-crystallized with its ligand colchicine. So we're comparing our compounds with their derivatives with the colchicine as the ligand of the tubulin polymerases. This is the structure of the enzyme with the compound and colchicine. Nearly the compound and colchicine are overlapped, they nearly the same, which encourage us to complete the research. The docking study was done before the synthesis to know whether we're moving right or we're just trying something that may not be successful. After completion of the synthesis and being sure of the structures, pharmacological results were done in the National Cancer Institute in Cairo on breast cancer tissues, in vitro of course. Our compounds were tested on the breast cancer tissues. Surprisingly, as we thought that the dimethoxy or the trimethoxy would be better in activity, as they mimic the tubulin polymerases synthesized before, but the hydroxyl were better in activity. Although the compounds already registered contain the methoxy, so we thought methoxy would be better in activity. But hydroxy gave better activity, and we thought that maybe because of the extra hydrogen bond this compound does with the receptor, tubulin polymerases. So it better fit to the receptor than the methoxy due to the extra hydrogen bonding. And the N,N-dimethyl benzaldehyde was the best in activity. This derivative showed better activity than all the other derivatives. We have 12 compounds synthesized. This one the best in activity. The methoxy were the least, which was surprisingly against what literature have already said, because we started synthesizing hydroxyl groups and amino groups, which was never been previously synthesized. The dimethoxyamino-benzaldehyde as a shift base with the benzotriazepine was the best in activity on breast cancer tissues, followed by the 2,4-dihydroxy. Lesser activity than the dimethyl amino, but still an active compound. Finally, the 2-hydroxy showed a good activity against breast cancer. These three compounds showed promising activity in breast cancer in vitro testing on cell cultures. We could continue to view them more, but the hydroxyl group added value. Then we could get out of the methoxy being a tubulin polymerase, being a must in tubulin polymerase synthesis. Now we added groups that could be used and could give better activity and better fitting to the enzyme. Thank you.
Thank you, Dr. Lamia, and actually we still do have time. It was an interesting talk.
Well, I found out that everyone's taking more than their time, so no, I was talking
no, actually it was great and clear, and we have the time for one or two questions.
Yes, please. Oh, Dr. Khayal. I'm afraid now.
You see, I'm always skeptical about in vitro results.
Yes.
Because you don't know if these compounds are given in vivo, whether they are metabolized, whether they stay in the same form.
Well, the work have not been finished yet. We're going to test the enzyme inhibition. We were using kits and using in vivo beside in vitro.
It would be nice if you would give these compounds in vivo and then take the blood samples and see whether these compounds are metabolized, whether they stay in the same form, and I love in vitro, of course, but I prefer in vivo. Nevertheless, I'm impressed. Thank you.
Yes, thank you for thank you. It's a great addition. Yes, we were planning to do so in the future. Now we after finalizing the synthesis, but it's a short time. I have to finish before the conference. I received these results last week. I have only 2 days to add them to the presentation. That's why I sent my presentation last Friday to Angela. She asked me, please send me the presentation, and she sent me several emails. I was unable to send them because I received the results on last Wednesday. I'm going to use in vivo testing, measure the enzyme. I haven't measured the enzymes yet. The enzyme itself, the tubulin polymerase, has to be measured. I'm just viewing number of tissues, number of cancer tissue, cells in a tissue, in a breast tissue, whether it's increasing or decreasing. It's something preliminary. It's not the final results. The final results will be done actually, hopefully, hopefully soon, to give the drugs, give the compounds in vivo, then testing the enzyme itself, and we will test its metabolism. It's a great addition from you. Thank you, sir. Dr. Khayal is my professor, and and I'm still up till now. I'm learning from him a lot. Yes, thank you. Anything else?
Any more questions?